My name is Gary Kern, and my wife and I own Tiller the Land Garden Center here in Lacombe, Louisiana, and I'm a heart attack survivor from May of this year. I was going down the hall and they were pushing me to the room where they do the stents and everything, and he made I made the comment, I don't think I'm having a heart attack, and he said, boy, you're living in denial. I woke up about 1 o'clock that morning, and I was having a little bit of tightness in my chest, nothing major. I could actually get up and move around the house, and you know, I kind of was trying to fight through it to see if it was stress. We were under a lot of stress at the time, and about 4 I decided, no, I better wake my wife up and call the ambulance, and so we did, and they ran an EKG, and it was somewhat inconclusive in that it didn't say I was having a heart attack and couldn't say that I wasn't having a heart attack. So I had actually signed the reject on the ambulance.
I just kind of stepped back and watched the fact that they weren't leaving, you know, even after the paperwork was signed, and I thought there's something more to this. And
then they made one comment about, you know, that one of the signs could be jaw pain, and I was thinking, you know, I had a little bit of jaw pain, so that's when I made the decision to let them transport me. And
you know, I said, well, sweetie, why don't you just go ahead and go, you know, and I'll be here. I'm going to be here waiting for you.
But I later found out that they, you know, one of the nurses, you know, spoke to my wife for about 25 minutes and kept her in the loop, because at that point they were not allowing anyone in there.
So we talked on the phone, which I felt was very helpful, since I was separated from Gary. We couldn't see each other, you know, just like every other family member's going through with the actual COVID. We were experiencing it now with the heart attack.
It really assured her and comforted her as to what was going on. So I was very impressed with the hospital's care.
Yes, definitely compassion, and that's where I said, that's where the woman came in, you know. I mean, I think she kind of came down to, if this was my husband, what would I need right now? And I think women just in general can do that.
I was really impressed with the hospital, and you know, they seem to keep the coronavirus patients isolated, and they tested you for coronavirus before you went in, and so I'm really glad I made that decision.
You know, we're grandparents, and that's one thing I kept telling Gary. Don't exclude medical care at this time just because we're scared of COVID. You want to see your grandkids, don't you? Well, let's go get you taken care of. When
you're making these decisions, you know, you're weighing that you're scared to go, but then we really need to take care of our health in this, and if it's something that's you think could be life-threatening, certainly go, is what I'd encourage you to do.